We finally got the information on Carmelo Anthony. We now know that he's suffering from a patella tendon injury. And we've been wondering why he's not shut down until the All-Star break. This is an injury that you can play with for periods of time. Lots of basketball players, lots of jumpers have this problem. And it usually starts out as a little bit of an injury to the top of the patella tendon, where the tendon comes from the kneecap. Now this is a model of a knee. Now it's a right knee. You can tell that because of where the small bone called the fibula is on this side. Now, so basically we're looking at the knee. You have the thigh bone or the femur here. You have the shin bone over here, okay? And then you have a kneecap here. That's looking from the side. Looking from the front, again, you have the thigh bone here. You have the shin bone here, and the kneecap is right there. There's a tendon that comes down to the top of the kneecap. That's called the quadriceps tendon. And you have the patella tendon that goes from the kneecap to this area right on the top of the tibia where it's attached. The most common place to have a patella tendon injury is up top, right where it comes off of the kneecap, and that's where the most likely area of patella tendonitis or jumper's knee occurs. When we're younger and there's growth plates, many of you may have suffered from Osgood-Schlatters disease, and that's because there's a growth plate right here, right where the tendon attaches into the growth plate right here, and that becomes fairly weak or is the weaker area. So rather than a jumper's knee or patella tendonitis like you'll see in an adult, you'll often see irritation to the growth plate where this tendon is causing a stress at that area. But that's not what Carmelo's dealing with. He's dealing with an injury up in here. Usually the end game of this type of injury or this type of problem with the kneecap tendon is something like a patella tendon rupture that was suffered by Victor Cruz, who was the receiver for the Giants. That's when this whole tendon just tears off. When there's a tendinosis or disruption of the normal fibers, it usually occurs in the center portion of this. And what happens is every time you jump, actually every time you land, you have pain right at this area. A lot of different ways we try to treat it. There's straps that go around the knee like this. We call them jumper's knee braces or patella tendon braces. They're simple straps. In fact, if you watch NBA enough, you'll see that they have special tape or special straps that go on the bottom of the knee. A lot of guys will do that because of this problem. It's very similar. We call it a counterforce brace. It's very similar to the brace that tennis players sometimes wear on their forearms to protect them from tennis elbow. Well, what happens is, the first thing that happens is you get some inflammation here. Usually treated normally with anti-inflammatories, ice. There's some structured rehab that we do. And usually, majority of the time, this will get better. The next step usually is there's other modalities that could be used, such as using medication that goes through the skin with certain devices. We either use ultrasound or e-stim, and we can get some cortisone or some type of medication to go through there. There are other modalities as well. PRP, platelet-rich plasma therapy, where we take the patient's own blood, spin it down, take out the stem cells from that, and inject it in this area, has also been found in some cases to be very helpful. Once it gets really bad though, there's only a few things that can be done. One is complete rest, but that doesn't always heal what is now not only tendonitis, not only inflamed tissue, but now degenerative tissue and fibrous tissue that really won't heal normally. So what we do in that case, if we've tried the PRP and other things and tried the modalities, tried rest, normally what the classic procedure for that is to make an incision centered over the area where it's really fibrotic and really kind of degenerative, and we actually cut that piece out. Now you're saying, well, we're taking out a piece of the kneecap tendon. That sounds like a horrible thing to do, but for those of you who heard of ACL tears and ACL reconstructions, one of the classic things that we use is the center 1/3 of this whole tendon. So we actually take a third, including bone up here and bone down here, and we know that over time, that becomes a strong tendon again. We have a lot of athletes that go through that. So we know that taking out just the bad portion of it is really no problem. So classically, that's what we do. Now I have a few MRIs that I wanted to go over, and then some operative pictures that some of you may want and some of you may not want to watch. But I want to show you that coming right up.